Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.
Hi everyone, I'm Natasha Williams.
And I'm Andre Morrow. Much more on those top stories in a moment on this week's edition of SWI. But first, the latest from Governor John Bel Edwards.
Today he toured the Pete Maravich Assembly Center on LSU's campus, which has become a makeshift manufacturing plant for PPE.
More on that LSU story in just a moment as you see the governor there. But today he also is defining when the reopening of the economy would happen. President Trump wants to get moving on that around May 1st. Governor Edwards says the severity of the virus here changes our timing.
And it's not a one-size-fits all. Here in Louisiana, we've been hit harder than all but two other states. New York and New Jersey each have a per capita case number that's higher than ours, but we're number 3. We're number 1 in per capita testing. We are going to move forward as quickly as we can, but with a balanced approach to preserving public health, which is critically important. And we're going to do that part of it first, and then we're going to have more announcements over the coming days and weeks with respect to the economy as a whole.
And now we'll look at other stories making news around our state. Republican senators Wednesday blocked an emergency plan to expand early voting and allow for mail-in balloting options. This for the state's presidential primary, now planned for July 11th because of the coronavirus pandemic. GOP Secretary of State Kyle Ardoin ran into a wall of opposition from fellow Republicans for his proposal to make allowances for people worried about the risk of exposure to the virus. The governor will keep public schools closed for the rest of the academic year because of the virus. It means 700,000 students will miss 2 months of their school year. It's not clear how districts should judge student performance, though, with that gap of time. School leaders had urged the governor to keep schools closed, as they have been since March 13th. Louisiana will try to combat the racial disparities in coronavirus deaths with a newly formed task force. The governor says the focus would be to educate at-risk minority communities about the virus and research how to deal with the underlying health gaps between blacks and whites in the state. The state health department says while African Americans make up a third of our population, they represent 70% of our COVID-19 deaths. Nursing homes, which house many medically fragile patients, have become a hotspot during the pandemic, and also more mysterious. The homes are not giving details to families that could help them understand the scale of the problem they're having. The State Department of Health says about 21% of nursing homes have reported someone testing positive for COVID-19, and of the more than 550 confirmed virus patients, 130 have died. The National Weather Service now says 3 confirmed tornadoes ripped through Monroe in Ouachita Parish Easter Sunday. The tornadoes all happened just before noon. One of them was an EF3 with peak winds estimated at 140 miles per hour, and it was on the ground for 9 minutes. There were no deaths, but more than 400 homes had damage, with 23 of them being destroyed. State Representative Reggie Begala died last Thursday after his battle with the coronavirus. The freshman House member from Lockport had been hospitalized. His son, Tristan Paul Begala, confirmed his father's death on Facebook, describing his dad as a profoundly honest and decent man who loved unceasingly. Begala was 54. And our condolences and prayers for the family. In New Orleans Thursday came the official cancellation of Jazz Fest and Essence Fest. In fact, New Orleans Mayor LaToya Cantrell is urging the cancellation of any festival in the Crescent City this year. And take a look at these numbers. As of today in the state so far, more than 23,000 coronavirus cases, 1,213 people dead, 1,868 in the hospital.
had worked out and felt totally normal on the Sunday before his life got turned upside down. State Representative Ted James says days later he was fighting to stay alive, and he told me at one point he wanted to give up. This is how residents across the state are used to seeing Representative Ted James on the floor of the House, building relationships, writing laws, helping to improve the lives of Louisianans. But this is how he spent several days this month, hospitalized, fighting to survive, machines helping him breathe, pneumonia filling his lungs, a victim of the coronavirus.
This, bout with COVID-19 was certainly the toughest fight that I've had to undergo with the not just the medical piece and the physical piece, but also the mental aspects and just the fear of the unknown.
I read that you really felt like this was it. You felt like this was over. You felt like you were going to die.
I did. And I felt like, I think I'm not going to say most importantly, but at times I felt like I didn't want to fight at all. With this virus, all the medical professionals say that this is not one that you just kind of sit and rest and let it. You have to fight. You have to, of course, take your medicine, but you also have to do your breathing exercises. You have to eat, right? You have to drink a lot of fluids. You have to, not just, they kept telling me you can't stay in the bed all day. You can't stay in the bed all day. For the first couple of days, I didn't listen. I didn't want to hear it. I felt so weak that I didn't want to fight back.
I understand that the day before you realized anything was going on, that you went for a run, you did your normal routine, and then just all of a sudden, right?
Yeah, I even did one of those, push-up challenges online with some of my frat brothers that sent me a challenge. So I was out at the lakes, ran a few miles. That Sunday, I just a regular day.
But it was within hours the symptoms of COVID-19 came on strong. James says he sweated through a couple of shirts and woke up with a fever of 102 degrees. The next few days were bearable, but by week's end, it was no denying he was getting weaker and very sick.
I didn't really start having trouble breathing until probably that Friday. And then Saturday, I had a friend of mine, my former legislative aide, actually, she brought some groceries and some food, and from my couch to my door, maybe 5 feet. And at that point, I couldn't. Like, people had been dropping off stuff all week. My friends were bringing food over. People were bringing groceries. And that day, I can remember she brought some canes. She brought some Jason's Deli and some other groceries. And a lot of those bags remained on the floor until I was in the hospital, and I had friends come to my house to, grab some clothes and kind of clean up. So a lot of the stuff never made it inside fully into the house because I just didn't have the energy to pick it up. Just completely wiped out. At times when I was really having difficulty, I've told friends it's almost like going for a sprint, stopping, and then expected to just bounce right back. And it just felt like, a constant search for breath.
Realizing he needed medical help immediately, he drove himself to the hospital, and for the next several days, he battled to survive, to even take a breath.
Then it was just like a constant focus on taking like as deep of a breath as I could.
So you had to focus to even breathe.
Mm-hmm. Yep.
And it was hard to do it. It was hard for you to focus to even breathe.
Almost definitely. Just a lot of it, of course, was fear. At the time, I'm still watching the news. I'm reading every article. So basically, you credit your nurses and the hospital people for helping you get back and engage? 100%. They, went above and beyond. I tell people about this nurse Quincy. I can't wait for all of this to slow down because I have, I definitely have to have a conversation with him. And it's going to go further than sending lunch. Like, I owe a lot to, Quincy, and then he was the night nurse. Stephanie was my day nurse.
James says for those thinking, I'm healthy, I'm young, and I won't get it, think again. He's in his 30s with no underlying health issues. He says anybody can fall victim.
I was in the hospital with a very close friend of mine. He's my age, has a young family, and we're both in there, fighting for our lives at 38. Number one, for folks in our generation, take the social distancing guidelines very, very seriously.
In keeping with his strong stance on helping to flatten the curve, Representative James told me if the legislative session opened tomorrow, he's not sure he'd be willing to go to the Capitol right now because of his concerns about the virus.
And now a Baton Rouge surgeon on the front lines of the pandemic. Dr. Henry Barham is a board-certified ear, nose, throat doc with a subspecialty in rhinology. That work puts him in a high-risk category of exposure for the virus. He and his staff, though, have armed themselves with protective gear that few have. He talked about what he and many on the front lines of the virus are facing every single day.
The ICUs are full. They are totally full with patients with COVID. Now the ICU teams, the critical care doctors, nurses, everyone involved is doing a great job of caring for these patients. But it is tough because you got a rapid influx of patients who are very ill. And so a lot of people have been moved to not their normal jobs, to doing new things to help service the hospital and help care for these patients.
Are all the people that you're seeing in these COVID-19 units, are they equipped with enough safety equipment, or is there a constant need to have more?
Nurses and staff, everyone's doing what they can and wearing surgical masks, but the question is that protective enough? They're, N95s appear to be available, or as they're coming in, they're being distributed, but there certainly are shortages of all of those, and so not everyone has them, in every circumstance that they probably should. And so there are still shortages, but look, hats off to all healthcare providers because they are stepping up and still taking care of these patients is what we're called to do in the first place, but putting themselves at risk. I mean, that's I think the harrowing story of all of this. Specifically in our field, Zara Patel, who's a rhinologist at Stanford, first alerted our community about 4 weeks ago on the risk associated with these surgeries because of the extremely high rate of transmission associated with the type of surgeries that we do, and recommended a powered air purifier respirator. Now, because we have Gulf Coast Occupational Health here, who is great, they were able to help us in this instance. So I contacted them. They provided us with P100 respirators, which is the highest level of personal protection. We were able to purchase several of those and distribute them to our staff who are working specifically in these cases that are known positive for COVID-19, but also in specific cases where we have a known increased risk of transmission. It does appear that when you use a drill, which is a device that we'll use in a lot of these surgeries, it becomes aerosolized, and that's part of the reason that you have such a high viral load with a high infectious rate.
When your day is over, describe what routine you go through that wasn't typical before.
Right. So that's part of the tricky part for healthcare, or that's part of the tricky issues with this disease as a healthcare worker. I'm very blessed and fortunate. I have a beautiful wife who and 5 little kids who are 9, 7, 5, 2, and 2 months old. And so protecting them is obviously paramount in my mind. And so at the end of my day, I typically will plan my day around doing procedures, seeing patients only on an urgent or emergent basis. And then I'll typically make hospital rounds in the evening where I know I'm going into the COVID ICU because there is a dedicated ICU. Once I complete my hospital rounds in the COVID unit or the COVID ICU, I'll then go shower in the hospital, change scrubs. I'll then go home, strip outside, leave shoes outside, strip, put them directly in the washing machine, and then go take another shower, and then have quarantine from the rest of them. So, and sleeping in a different room from them.
So you're not around them at all?
I see them from a distance, but I try to decrease contact just in case there's any virus that is brought home. I do think the human immune system wins ultimately. We are perfectly created and we can fight viruses along with other forms of infections. It just takes time, and that's where lengthening the curve does help, because you can have people get the disease, recover, and then they're protected from it.
Dr. Barham, thanks so much for everything that you do.
Ultimately, we have to get through this as a society, and everyone plays a role. Social distancing, while it can be annoying and go on for for a long duration where you feel like you're stuck at home, you actually are helping a ton by helping prevent the spread of this disease. So thank you for educating us all.
They are startling statistics that led the governor to form a task force. The fact that 70% of the victims of COVID-19 in our state are African American. We talked to a local doctor who wasn't shocked by the numbers, and he says he hopes the revelation leads to much needed change. Dr. Rani Whitfield says he was not shocked to learn that African Americans, who only make up a third of the state's population, make up 70% of those who've died from COVID-19.
Pandemics, epidemics, catastrophes like Katrina and Rita, when those things happen, they tend to expose the weak fiber in our healthcare system. So things are going along okay, but there are many doctors on the front lines of these disparities daily that are addressing these things on a daily basis, but it's not an issue. It's not the topic of the day or the topic of the month. I think this has really, even in the negative issues that are associated with all these health disparities, I'm actually glad that things are now on the table being discussed, because I think we can address this. And now the federal government has to step up and start beefing up the funding that we give to these community health centers.
And actions that could lead to more funding in African American communities is a start, but
there's racial and implicit biases that go along with this too. So education about African Americans. I think our Surgeon General said some things that upset a lot of folks the other day. He mentioned Big Mama and said some things that weren't just basically suggesting that Black folks don't do the right thing. And that's not it. I know many African Americans that eat well and exercise on a regular basis, and they still come into my office with poorly controlled blood pressures and diabetes. So there are some underlying factors. And when you talk about those social determinants of health, or maybe the lack thereof, communities that don't have sidewalks, don't have parks where you can exercise, where people can't go out and exercise because their house is next to a busing company. And so their asthma is being exacerbated by that. When you have these disparities in health from a socioeconomic standpoint, these are the things that cause the problems.
Governor John Bel Edwards has put together a task force to specifically look at the COVID-19 disparities in the African American community. Dr. Whitfield is hopeful its findings will lead to new policies and practices that ultimately lead to better overall health care for African Americans.
One thing about COVID-19 and this whole pandemic is that there won't be a light switch, as Dr. Fauci said, when everything is over. Because I don't see the end game right now myself personally. I don't see us on May 1st, if by chance that happens to be the date that we actually go back to quote unquote normalcy. I don't think our new normal will ever be what we used to be prior to that. But who's going to go back to work first? How do you transition that in? What restaurants will be opening? So again, the conversation about the disparities in healthcare have to remain on the table. And I think there's some really great people. I had several colleagues of mine, white and Black, reach out to say, hey, Dr. Whitfield, what can we do? How can we help each other to make this issue either go away or at least improve it? So people are concerned and want to make a difference and want to help.
Dr. Rani, who many know as the hip hop doc for his unique programs geared toward at-risk communities, says social distancing is extremely important, but for many African Americans, it's not an option. They are service workers, grocery store clerks, and others. And while many of us are working at home, they don't have that choice. They have to go to work.
As we showed you at the top of this broadcast, LSU has turned the PMAC into a large-scale arena on campus to make personal protective equipment. It's part of a statewide university response to support medical and other workers on the front lines of the pandemic. LSU Interim President Tom Galligan outlined the university's broad response and efforts to help. I talked with him this week. A mannequin shows off a sample of what has LSU workers sewing and stitching. Emergency response has transformed the basketball heart of the Tigers into a manufacturing center.
The PMAC is now, I joke and call it our manufacturing division.
President Tom Galligan says, in these unprecedented times with so much focus on what we can't do, it's important to take action with what we can do.
We are making gowns, and we will be making masks as well. It all started in the garage of a physics professor, Wayne Newhouser, and I'll tell you, the man is a genius. And so in his garage, he had a student, he had high school students, and what they did is they came up with PPE prototypes, and we learned of it. He shared the idea, and we went into mass production.
In this statement, Galligan outlined how the LSU community has galvanized in the fight against the virus. It's a reminder of how it mobilized 15 years ago, following the devastation of Hurricane Katrina. The Baton Rouge campus quickly became evacuation central. Says Galligan, at every defining moment from World War II to Katrina and now the coronavirus outbreak, our people have undertaken meaningful and abiding public service.
Athletics stepped up. I called Scott Woodward. I said, Scott, hey, can we use the PMAC? He said, absolutely. Facility services has been fantastic. Engineering's been involved. Our emergencies operations center is working. Environmental health and safety. I mean, you name it. Office of Research and Development. The theater department loaned us sewing machines.
Those machines and the hands working them will produce 200,000 gowns made of billboard vinyl. Protective, reusable, easy to clean and sanitize, the creations are a safe bet for frontline physicians and all medical staff to wear. Lamar Advertising and Circle Graphics donated the vinyl, 600-pound rolls from which the gowns will be cut. And Energy Tech leader Baker Hughes is giving the materials to make masks.
In addition to that, on the flagship, we've been testing in vet med.
Yes.
A team of scientists have been testing in vet med. Our chemistry department has been making hand sanitizers for the Department of Corrections. Our biosecurity folks have been donating PPE. So really, the flagship, the PMAC is sort of the signature operation right now, but with the vet med testing, but the whole flagship is on board with this.
Well, it's amazing. And you go statewide from Shreveport to campuses all over the state. They are contributing, doing something, making something, and giving.
The Shreveport Health Sciences Center they've been testing there. They have a 24-hour turnaround. They graduated their medical students on Monday, April 13th, so they could join the workforce earlier. They're doing testing for with nitric oxide, a clinical trial, and more. They're increasing surge space. In health sciences in New Orleans, I mean, they have been in a hot spot, frontline treating patients. They have clinical trials going on with hydroxychloroquine and Z-Paks and others. And so we're incredibly proud of the effort there. Alexandria, donating PPE.
There are financial donations coming in from students. And there's the Pennington Biomedical Research Center with a community outreach program.
If you get the business report in the next few weeks, there's going to be a column by a Pennington researcher on basically living healthy during the age of Corona. And the Ag Campus, as you know, they are literally all over the state of Louisiana. They've been donating PPE. They've been researching. They've been doing virtual 4-H. So all those students in 4-H who can't meet physically have an activity. So LSU across the state, there are 8 campuses. And so right now I like to think of us as a big old intelligent octopus who's reaching as far as we possibly can. And Andre, I would add, what we're seeing is in many cases the results and benefit of research. And this is not esoteric research. This is research that we're putting to use to make people's lives better and literally to save lives.
So thank you so much.
Thank you. Talk to you soon.
And kudos to the LSU family for all they do. Coronavirus pandemic has turned our lives upside down. It's killed our loved ones, it's uprooted our economy, and in many cases threatened every part of life and work as we know it. Next Wednesday night, Louisiana Public Square tries to relieve some of the anxiety with a special edition Pulse of a Pandemic. Governor Edwards and members of the state's congressional delegation join other experts to discuss the status of the epidemic in the state, financial assistance for those in need, and economic concerns moving forward. During the broadcast, viewers will have an opportunity to join LPB in a live survey and text conversation to share thoughts about the issues. Pulse of the Pandemic airs Wednesday at 7 p.m. on LPB and on WLAE in New Orleans, with an encore on Friday at 11 p.m. Visit lpb.org/public square for more details.
And everyone, that is our show for this week. Remember, you can watch anything LPB anytime with our app.
Download it for free from your app store. This upgraded version features news, public affairs, documentaries, how-tos, and many more programs. And please follow us on Facebook, Twitter, and Instagram.
For all of us here at Louisiana Public Broadcasting, I'm Andre Morrow.
And I'm Natasha Williams. Thanks for watching.
Until next time, that's the state we're in.
Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.